Hello and welcome to this Southampton 5 in 5, Alternatives to Medicine. Number 1. Know the breadth of your options. Whether you have your sights set on a medicine degree or you're currently unsure, it's worth first reviewing exactly what your options are. Currently, there are over 350 different NHS careers, and every single one of these careers makes a difference to people's lives every day. For example, you may think that you want to become a psychiatrist, but you'd not heard of a clinical psychologist before. Both fields work with people with mental health problems in the NHS. It's just a psychiatrist may offer psychotropic drugs to treat depression, where a clinical psychologist may offer talking therapies. Currently, clinical psychologists do not require a medicine degree. It's definitely worth considering whether there are options available to you other than traditional medicine routes. Number 2. Look into alternative salaries. A lot of students consider a career in medicine because it's high salary, and that can sometimes be an overarching factor. But did you know that medicine alternatives can also have appealing salaries? Make sure you have a look into the following factors. Consider NHS banding. Consider working in private practice. Consider working for public companies. Consider variation in roles in other sectors. And progression. Think about progression versus the time it might take you. Here you can see a comparison between two NHS-based medical careers. I've looked at expected working hours and salary range. Now, whilst the surgeon may immediately seem attractive, biomedical scientists can be too. By researching, you'll find that a band 9 with 5+ years of experience can earn roughly £104,000, and at graduate entry as a biomedical scientist, at band 4 with less than 1 year of experience, it's still roughly £24,000 a year. Always remember when thinking about salary ranges that these are never guaranteed figures. Whatever path you take, medicine or not, you still need to work hard to progress. Number 3. Quality of life importance. When considering medicine alternatives, it really is important that you take into account your quality of life. Medicine, however well paid, could lead to becoming stressed and burnt out, with a recent study finding almost a third of UK doctors might be suffering from burnout and compassion fatigue. Is this something that you'd considered? I've compared the same two professions as seen previously, but here we look at average working hours. A biomedical scientist may have their weekends and evenings free and work more of a standard week. With a doctor, this may not be the case. Please use this NHS comparison tool to compare different careers you might be interested in. Number 4. Self-reflection is key. It's best to decide what you actually want out of a career in the medical profession and asking yourself why you want to be in a caring career and what you want to achieve. This is possibly the most important thing. A really good way to start is asking yourself these 4 things. Do I want to work in a caring role a little bit more widely? Do I want high levels of patient contact, or am I more happy working behind the scenes? Do I want to find the cure for diseases? Because working as a doctor, you may not do this. And also, do I want a lifelong career of learning or progression? And number 5, making use of your 5th choice. If you are thinking of applying to medicine, your 5th choice on UCAS is for a non-medicine subject, but it can still be related. You may wish to be strategic in your choice. For example, if you choose a biomedical science programme, does the university you've chosen have a good medical school? You could maybe think of applying for graduate entry medicine in the future. What are the statistics on this? These are all good things to know. And make sure you look into all your options. As I mentioned, your 5th choice could be a related subject, but it doesn't necessarily have to be science. These subjects are all subjects you may wish to apply for as your 5th option, and here at Southampton we have a fantastic life science programme, including subjects such as cardiac physiology, podiatry and audiology. Remember, there are many journeys from A to B in the field of healthcare, so make sure you understand all your options fully. So, number 1. Know the breadth of your options. There's way more than you might originally think. Number 2. Research all different pathways and the salary options. Number 3. Assess what quality of life you wish to have in your professional career. Think about what kind of future you want. Number 4. Ask what you truly want out of a career path in this field. And number 5. Use your fifth medicine choice intelligently if you do decide to apply. Thank you for listening and good luck with applying for Alternatives to Medicine.